So hello guys, now we'll continue with our discussion of body fluids and circulation, and the next topic is blood grouping. This is a topic that everybody knows, everybody are very much good at it, all are good at it, and maybe that is the reason why which you don't get much questions in the NEET exam from this. But obviously this is a topic which has its own extensions towards genetics also. So in the class 12 genetics, you will be learning the inheritance patterns of blood grouping, or the blood group that we are following, how is it inherited between a parent and a child. So even that is much more important. So it is imperative that we have a good hold on this particular concept. So let's start from the basics and we'll try to expound it to the level that is expected out of a NEET aspirant student. So let us understand the blood grouping. Now see, you can see this is Karl Landsteiner. Right, this is Karl Landsteiner, and he was an Austrian biologist, and he is the first person to devise a method for grouping blood. Right, maybe because of the fact that people used to require blood because of an accident or a trauma, and without matching the blood, if you try to instill the blood, the patient can even die. So that can be a reason by which people started thinking whether how the blood of a person can match with someone else's blood. And this all led to the understanding of the blood grouping and cross matching as of now, right? So he devised the ABO blood grouping, right? This is a blood grouping that we are now following. So as of now, the blood groups that we follow are two in number. One is the ABO blood grouping and the second one is RH blood grouping. So this is the most commonly followed blood grouping system in the world. Even see, the understanding even in a medical level can be even restricted to this ABO and RH blood grouping. Right, there are many other blood groups like P antigen, Duffy, Kelly system, and there is some other blood group called by the name of Bombay blood group. And in all entrance classes that I have seen, there will be some kind of a mentioning of Bombay blood group as well. But I don't think that is much required at your level, and no questions will be asked from the concept of Bombay blood group at a level of NEET UG aspirant. So that's all. We will be discussing only ABO and RH blood grouping, right? Okay, so the ABO and RH blood grouping are based on certain antigens and antibodies, right? These antigens are there and there are certain antibodies. On the basis of that, you will be grouping the blood into either an ABO blood group or an RH blood group. So let us now start the discussion of the ABO blood grouping. Right? So let us understand the ABO blood grouping in good detail. So if I start talking about this, I was telling you that there is something called by the name of an antigen. This is antigen, and there is something called by the name of an antibody. Right? Now, my first question is, where is this antigen located? You will say blood. Not enough. Where exactly in the blood you will see the antigen? These antigens are certain glycoproteins which are present on the surface of RBC. So this is present on the RBC surface. Okay? From now on, you should not have any confusion in this. RBC surface is the site where you will be seeing the antigens which you are using for the purpose of ABO blood grouping. Antibody, where are these antibodies present? Just think about it. Where is this antibody present? We were discussing plasma, isn't it? What are the component of plasma? You have water and many other substances. There is something called by the name of plasma proteins. And the three important plasma proteins are albumin, globulin and fibrinogen. Right? Now globulin, what is globulin? Gamma globulin is the other name for antibody. Whatever antibodies you are having, you were exposed to a disease, you caught chickenpox, and then you started producing antibodies against it so that you will not encounter chickenpox ever in your life. Where is this antibody present? This antibody is present inside your plasma of the blood. So it is in the fluid part of the blood called by the name of plasma, and this antibody which you use for the purpose of ABO blood grouping is also present in the plasma. Where is this RH antibody present? It is also present in plasma. Where is this RH antigen present? Again in the RBC surface. So antibody is always and always present in the plasma. Remember that, okay? So antibodies are present in the plasma. Right? Now I would like to call it by the correct technical name. So the technical name for antigen is agglutinogen. Right? I would try to call it as AG. From now on I will be writing it as AG. This I will be writing it as AB, antibody. Right? And this is also called by the name of, or the more technical correct form will be agglutinin. Right, these are the words that you are supposed to remember. The site of antigen, site of antibody. What are the other names of antibody? So these are the features that we are supposed to understand. Now let us discuss the grouping system. So guys, let us now understand how you are actually grouping the blood. So that concept can be understood now. So let us write group on this side, antigen, antibody, and who can donate the blood to such a group. We will understand the donor for that. Okay. So this is an NCERT table that we are just trying to recapitulate here. Now the point is antigen, antibody, donor, isn't it? So four possibilities: either he can have A antigen, or he can have the B antigen, or this person can have both A and B antigen, or this person can have no antigens, nil. These are the four possibilities that you can have with two antigen. A and B are the two antigens that are there, and the antibody that you can have is A and B antibody. Okay, right. So A antigen, if a person is having A antigen, the body will not produce antibody against A antigen. The body will produce antibody against B antigen, right? So that is B antibody. If the person is having B antigen, the body will not recognize B antigen, it will recognize some other antigen, and that is A antigen. So when he is exposed to A antigen from the environment, from the food he is taking, the body will produce antibody against the A antigen. It will not produce anything against the B antigen. It will not destroy its own things, isn't it? So this is A antigen. If he has both antigens here, the body will not produce anything at all. So there is nil, no antibody here. And here, since no antigens are there, when he is exposed to the environment, he will be getting antigens which are similar to A antigen, B antigen. So the body will produce antibody against everything. So that is why A and B antigen antibodies are produced by the body when a person is having no antigen on the surface of RBC. I mean no antigen for the purpose of grouping the blood, which are relevant in ABO blood grouping present on the RBC. Okay, RBC has millions of antigens. One of them is, two of them are A and B. Right, this you will call as the A group, this you will call as the B group, this is AB group, and this is O group. Right, this is the basic idea that you are supposed to have. Now tell me, can a blood group person donate blood to A blood group person itself? The donor and the recipient, it is imperative that both of their blood groups are matching. So obviously I understand in all these cases, one possibility is, this is A, the same blood group person can donate blood to the same blood group person. Here a B blood group person can donate his own blood to B blood group person. The donor and the recipient, if they are having the same blood group, there is no problem, isn't it? And this is AB, so an AB blood group person can donate. Here an O blood group person can donate. It is not a problem, isn't it? Now what else do we need to understand here? This is what we are supposed to know. So now comes the concept that if you are considering a donor, you have to look into the antigen of the donor, and if you are considering a recipient, you have to consider the antibody of the recipient, right? This is the basic idea that you are supposed to have, and then we can fill up the rest of the donor criteria. So for the donor, I need to understand the antigen of the donor. For the recipient, I need to understand the antibody of the recipient. Here these are the recipients. I am finding out donors for them, isn't it? So if the A is the recipient, I need to continue by search for donor based on the antibody of the recipient. So if A is the recipient, I should consider the antibody of the recipient. Who is this antibody of recipient? B is the antibody that A is having. So this is my recipient, B is the antibody that recipient has. I have to consider it. So B will destroy B, isn't it? B antibody will destroy the B antigen and the person will die. So you should not give B here. So I am giving A here. Okay, understood. What else can I do? I can give that particular blood group that does not have an antigen. Why? If there is an antigen, B antigen will destroy it. If there is B antigen will destroy it. Two possibilities, either you bring a separate antigen or you bring no antigen at all. So I brought a separate antigen here, A antigen. B will not cross react with A. Another possibility is I can bring this one. There is no antigen to react here. So O blood group is a possibility here. If B is the recipient, first possibility, the same blood group donor can give blood to the same blood group recipient. No problem in that. Understandable, isn't it? Now here you have an A antigen here. here you have no antigen, you can directly give it, because we are considering the antigen of the donor, antibody of the recipient. Antibody of the recipient is A, antigen, there is no antigen, so you don't have to worry at all. So this is a possibility. Now, in case of AB, you don't have any antibody, so recipient is not having any antibody, right? So you can give A blood group here, you can give B blood group here, and O blood group also. And finally, when you consider this O blood group, here you are having both antibodies here, so you should only give O blood group here. If you give A blood group here, this A will react with A. If you give B, then this B will react with the B. And if you give AB, both of them will react, so it is not possible. So that is why the only possibility here is O blood group. So this is the basic idea that you're supposed to have. And from this, you can understand two things here. One is the universal donor who can donate blood to everyone. O is here, O is there, O is here, and who is here. So in all four blood groups, one particular donor that is dominating everyone is O blood group. So the universal donor is O, and the second one is universal recipient, who can receive blood from anyone else, and that is AB. So this is AB, right? So this is a very important understanding that you are supposed to have, and they can ask you these questions directly, especially in the practice test. In the NEET exam, I haven't seen much questions in this in the recent years. But that doesn't make it less important, right? In the next year, some question can come out of that, which is a possibility. So that is why we are learning everything. So yes, this is the basic idea of ABO blood grouping that you are supposed to understand. And in first year of your MBBS, you can check your own blood group. Okay, so that is an experiment. This is an important lab test that you are supposed to do in first year of your MBBS. So that makes it more interesting. So by then, make this thorough. Let us come to the discussion of the RH blood grouping now. Okay, so this RH antigen was first discovered in a species called by the name of rhesus monkey. Right, this was first identified in rhesus monkey. So that is why you are taking the first two letters of rhesus, and that is why we are calling it as the RH blood grouping. Right, this is the basic historical fact that we are supposed to know. And when we tested everyone, we came to an understanding that one important point is that 80% of people are RH positive, and the rest 20% of the population in the world are RH negative. What do you mean by RH positive? That means this person and RBC contains the RH antigen. That means RBC has RH antigen. So when the RBC of a person contains the RH antigen also, we were discussing A antigen, B antigen, right, in ABO blood grouping. This is yet another antigen that is called by the name of RH antigen, which is again present on the RBC. Right, RBC has millions of antigens. One of them is RH antigen. If the person is having RH antigen on the surface of his RBC, just like A antigen, just like B antigen, if the person is having RH antigen also, you will call this person as RH positive. If he does not have RH antigen on the surface of his RBC, you will call him as RH negative. So when I say a person is A positive, you are understanding that as per ABO blood grouping, it is A blood group, and as per the RH blood grouping, it is RH positive, or the person is having the antigen RH on the surface of his RBC. So such a person has A antigen as well as RH antigen on the surface of his RBC. This is the only basic idea that you are supposed to have. This is called by the name of RH grouping, right? So this was first discovered in rhesus monkey, and that is why this RH term was taken. So as of now, we have discussed the two important most commonly followed blood group systems in the world, ABO and RH. Where do you use this? For transfusion of blood, isn't it? Imagine that somebody has a loss of blood from the body and he is in urgent requirement of blood. So you have to consider the ABO blood grouping as well as RH blood grouping for taking out the blood, for cross matching, and this is done at a blood bank level. So this is very much important. That is how you order blood in the hospital for purpose of transfusing blood to a person who is in dire requirement of blood, right? Now there is another concept to this which is slightly beyond the scope of a normal class 11 student. There are many other things associated with this. So Yes, one important feature that you're supposed to know about this is the hemolytic disease of the newborn, or how is the RH blood grouping, specifically the RH blood grouping, significant during pregnancy and delivery. So let us suppose that the mother is RH negative. She doesn't have RH antigen on the surface of her RBC, and the fetus is RH positive. So an RH positive fetus is growing inside the womb of the mother. Now, does it make any big problem for the mother? Not really, because let us suppose this is the first child that she is having. So till the time of delivery, she will not have any other consequences because of this particular child, because the mother and the child are separated by the placenta. The child is inside the uterus, so this will not cause much problem. But during the delivery, what will happen? So during the first child, so if I talk about the first child who is RH positive, this child is RH positive and the mother is RH negative, till the time of delivery there will not be any problem. Why? Because the blood of the child is not going into the blood of the mother. The child is inside the uterus. There is blood vessels. This is the maternal blood vessel. These are joined like this, but they don't intermingle. The blood is not mixing between the blood and the child, blood of the mother and the child. So there are blood vessels of the child, blood vessels of the mother, they are like this, and this is covered by connective tissue, and this is what is called by the name of placenta. But there is no problem with this, because the child blood is not mixing with the mother, because RBCs, the capillaries, the blood vessels are in close contact for the purpose of transmitting, the purpose of sending nutrients and receiving the waste from the child. So the maternal blood vessels are sending the nutrients into the fetal blood vessels, and the fetal blood vessels, from there the waste are taken to the maternal blood vessels, but the blood is not mixing with each other, right? And since the blood is not mixing, there is no problem. But during the time of delivery, the placenta begins to separate. So the blood vessels are broken. The placenta is separating. That means when the blood vessels are broken, the blood starts flowing. And this blood will intermingle. This blood will mix. So there is mixing of blood during the time of delivery. So this is the point that you are supposed to know. So if this is the first child that this mother is having, then the blood will mix only at the time of delivery. So the blood mixes. Blood of the mother and the fetus will mix during the time of delivery. Okay, and the child is born. There is no much problem in that, isn't it? Now, is there anything that is important here? The child is born, normally there is no problem, because blood is mixing. Okay, I do agree with that. But for a reaction to occur, it will take some time. By then the delivery has occurred. There is no problem other than this. But this mother will start synthesizing antibody against this RH blood that has come into her blood circulation. So the child blood, once the blood is mixing, the child blood is coming into the maternal circulation, right? So the child blood or the fetus blood is coming into the maternal circulation. The maternal blood is mixed. Now this maternal blood is there, and along with that there is some bit of RH positive blood also. So the mother is now having some RH positive blood in her body. So that is destroyed in the mother's body. Along with that, the maternal immunity sees that this fetal blood is RH positive. So this RH positivity is recognized by the immunity of the mother, and it will start producing RH. It will start producing RH antibody. I will write it here. The mother will start producing RH antibody in her blood. And this RH antibody, once it is synthesized in the mother's blood, it will remain in the mother's blood for the rest of her life. So this RH antibody is synthesized in the mother due to this particular fetal blood exposure. And this maternal immunity is producing RH antibody. This will destroy the RH antigens on the surface of the fetal blood that has mixed, and this will remain in the mother's blood for the rest of her life. So this is the basic idea that you are supposed to have. This is there. Now what happens is, if she has a second child, what will happen? What will happen as a result of that? This child is growing inside the mother's womb. But the point is, this antibody is of IgG type. That means it can cross the placenta. Right? So even if the blood is not mixing, the IgG type antibody, which is the RH antibody, it can directly grow from this area to the other area, just like the nutrients are going from the mother's blood to the fetus blood. This antibody will also go from the mother's blood to the fetus blood during the time of pregnancy also. Not just during the time of delivery. It can go from the mother's blood to the fetus blood during the time of pregnancy also, because it can cross the placenta. This is the most important feature. So it can cross the placenta, right? So in the second child, this child will receive the Rh antibody from mother's blood. When it receives the Rh antibody from the mother's blood during the pregnancy itself, not during the delivery. It doesn't have to wait till delivery. If the antibody can cross the placenta, then directly it can go into the fetus blood, and it goes there and it destroys the Rh antigen on RBC surface. And this can lead to tremendous consequences. And when the child is born, the child can have jaundice, anemia. The blood is destroyed, isn't it? And once the blood is destroyed, the child can have jaundice. When the blood is destroyed, there is lack of blood, which can cause anemia, and it can go for a fetal death also. Right? So the child can have jaundice, anemia. The child can be born with jaundice and anemia. The child can be born normally, and after some time the child can start developing all the features, or even the child can die within the uterus. It can go for an intrauterine death. All these things are possible, and this is what is called by a general name, called by the name of erythroblastosis fetalis. Right? Or I can call it as the hemolytic disease of the newborn, and this is the word that is given in NCERT, erythroblastosis fetalis. So the point that I would like to make it clear here is that the child doesn't need to wait, the second child doesn't need to wait till delivery for the blood to mix. Even during the time of pregnancy itself, since the antibody can cross the placenta, this antibody will cross the placenta and go into the fetal blood. Just like nutrients are crossing the placenta and going into the child's blood. Just like the waste of the child is going from the child blood into the maternal blood. Right? This is possible during the time of pregnancy itself. And the child can show a lot of problems. One of them is anemia, jaundice and other things when the child is born. And there is no assurance that the child can be born. The child can die within the uterus itself. Right? So this is a very serious complication, that is intrauterine death, and that is seen in erythroblastosis fetalis, or the hemolytic. Hemolytic means the RBCs or the blood is lysed, destroyed. Hemolytic disease of the newborn is what we are actually discussing here. Now there is a method to prevent it, and this method is very much important. So method of prevention is important here. Right? What will you do? Just after the delivery, just after first delivery, we know the blood group of the child, isn't it? After her first delivery, if the mother is Rh negative, if Rh negative is the mother's blood, if the mother is Rh negative, we have to give anti-Rh antibodies. Or the term that we are using as a medicine is anti-D antibody, anti-D antibody. Okay, so this anti-D can be given as an injection, and this will destroy the antibodies which are produced inside the mother, right? So I hope you are getting the concept now. After the first pregnancy, after the first delivery, the mother is having a mix of fetal blood also. Now the mother will start producing Rh antibody here. This is produced by the mother, isn't it? This is produced by the mother. We will destroy this Rh antibody. So whatever we are giving it as anti-D, this will actually come and destroy this particular aspect. This will be destroyed by the anti-D antibody. So this is going to be destroyed by it. Okay. So the anti-D antibody which we will be giving will destroy the Rh antibody which is produced in the mother after her first delivery. So just after the first delivery, give anti-D injections, and this will prevent this kind of an occurrence. So this is all that we are supposed to remember so far as the blood grouping concept is concerned. So in the next lecture, we will take forward the other concepts that are there in this particular chapter. So if you like this, please like, share and subscribe to my channel. Click the bell icon to receive notification whenever I upload a new video on YouTube. Thank you.